My name is Ethan Matz. I'm a fellowship-trained reconstructive urologist with Erlanger, and I do men's health, reconstruction, and genital prosthetics. An artificial urinary sphincter is a device that's placed for folks who have urinary incontinence. Mostly it's used in males who have incontinence after surgery, whether that be prostate surgery or urethral surgery, who are leaking significantly. What the device is it's a three-piece device where there's a cuff that goes around the urethra. That cuff always stays closed and holds the urethra closed. There's a pump that's concealed in the scrotum and a small pressure regulating balloon that's in the belly behind the muscles. And the way the device works is it holds the urethra closed, holding urine back. When you're interested in wanting to urinate, you stand over the toilet or the urinal, squeeze the device, the cuff opens up, you get about 90 seconds to 120 seconds to urinate through the device, and slowly over that time, the device closes. And as it closes, it holds the urine back again. If you feel like you need to continue to urinate after that time, you just press the device, that opens again, the cycle starts again. But otherwise, the device stays closed and holds urine back. You can reduce the amount of urinary leakage you have significantly, and we hope that people will get to 1 pad a day or less. So for folks who are interested in urinary sphincter, the first step is a consultation with a prosthetic urologist. We will go through a history, physical, take a look at what the leakage looks like at the time of the exam, and then we decide, okay, we think you're a patient who might benefit from a sphincter. If that's the case, the next step is a visit for a cystoscopy, which is a small fiber optic camera that looks into the urethra. And basically we're looking for any scarring or damage to the urethra that we need to address before placing a sphincter. If that's all clear and we don't see anything, then you come to the operating room for a sphincter. The sphincter is placed as an outpatient, go home the same day, no catheter at the end. But for 6 weeks after the device is placed, you're going to continue to leak. And that is to allow things to heal. We want them to heal before we activate the device. Then at 6 weeks, you come into the office, we activate the device and make sure that you can use the device. Once we are comfortable that the device is in right place and that you guys can use it, then we'll let you go off and use the device. And then we see people back at 3 months to make sure that things look good. After that, people are off on their own, hopefully much drier than when they started. So one of the things I want people to know about the artificial urinary sphincter is that it's a treatment for leakage. And after these surgeries, a lot of folks out in the community think, this is just the way that I'm gonna be, I'm gonna leak. And I want people to know that there are things we can do. And so if you're out there and you're having stress-based leakage, those are the people that need a consultation for a sphincter, and they can potentially be dry. It is not normal for patients to be leaking, especially for men to be leaking. There's something that can be done, and that's the sphincter, and I think all it takes is a consultation to figure out whether it's right for you.